Good morning, ladies and gentlemen. Welcome to my TV show. My speech today will be about Gaucher and Niemann pick diseases.
Gaucher disease.
Gaucher disease is one of the most common lysosomal storage diseases and the most prevalent genetic defect among Ashkenazi Jews. It occurs due to deficient activity of the lysosomal hydrolase, acid beta-glucosidase. The main affected chromosome is 1q21-q31. It is divided into three types. Type 1 or adult type, and that type will be discussed briefly at the end, as it is out of range of our pediatric age group. Then there are other two types, type 2 or infantile type, and type 3 or juvenile type. On the other hand, we have another disease called Niemann pick disease. It's also divided into three types. Types A and B result from the deficient activity of acid sphingomyelinase, which will lead to pathologic accumulation of sphingomyelin. Type C is due to lysosomal cholesterol export defect. The whole problem is due to defect in chromosome 11p15.1-p15.4. By the way, I used to remember this disease by this sentence. No man pick nose, with his finger. This sentence will remind you the relation between Niemann and sphingomyelinase. Now, I will show you one important table. Either pause the video or take a screenshot. This table is more than enough. Gaucher disease type 3, or juvenile type. It is similar to type 2 but subacute in onset and milder course. It is characterized by slower psychomotor deterioration pattern, no cherry red spot. Splenomegaly more prominent than hepatomegaly. It is further classified as types 3A and 3B based on the extent of neurologic involvement, and whether there is progressive myotonia and dementia in type 3A or isolated supranuclear gaze palsy in type 3B. Neurologically, it is characterized by subacute neuropathy. Convergent squint and horizontal gaze palsy is an early sign. Niemann pick disease type B, visceral involvement. Neurologically, it is characterized by milder course, no neurological involvement or rarely ataxia. Hepatosplenomegaly and lung infiltrates exist, and hence, it's called visceral type. Cherry red spot appear in some patients only. It is very important to remember the differentiating point, which presence of hypercholesterolemia. Niemann pick disease type C, neurological deterioration has variable age of onset. Vertical ophthalmoplegia and dystonia is more prominent in this type. Early hepatosplenomegaly exist and hence, early conjugate hyperbilirubinemia. Cherry red spot also may exist.